What is up, everyone? It's registered dietitian Michael Murphy, also known as Dietitian Dad, and I'm here with the top 5 mistakes you might be making after your weight loss surgery. Okay, let's get into it. Now, number 1 is very, very important. When you have weight loss surgery, you never understood beforehand what it felt like to have a smaller stomach. So you have to learn about how you feel, when you eat, when you need to stop eating. But understanding the word fullness is so important. And you don't want to eat until you are full after weight loss surgery. This is key. Whatever you think fullness is, take 2 to 3 bites less and stop eating at that point. Now, it takes time to learn that. It takes time to kind of get a feeling for your new stomach. I understand that. So you want to practice a lot after the surgery before you get this fully down. But it's important that you don't keep eating until your new stomach screams at you to stop. Number 2 is very obvious, but you have to see your surgeon, your doctor, your dietitian, anybody else on the staff, because they need to see you after their surgery, especially right in the first month. But even after 6 months, even after 1 year, we want to make sure that our patients are losing the weight and then hitting a point where they're maintaining that weight loss and keeping that off. So if you're seeing your surgeon even 5 years after your surgery, that's a good thing. Don't go MIA on them. They want to see you in the office. And if you can't see them in the office because you had surgery far away, then make sure you understand what they offer virtually for counseling, or maybe seeing a surgeon that's local to where you are. Number 3 is you're not understanding the concept of caloric density. Now, caloric density or calorie density is very, very important for somebody who has a smaller stomach, because what we're talking about is how many calories per bite. If you want to make it easy on yourself, you can take 1 bite of broccoli or 1 bite of a raspberry versus 1 bite of peanut butter, and there is a huge difference in those calories. So even though you're eating small portions, it's important that you understand that there could be 1,000 calories in that same portion versus some other portion that's only 50 calories. Oils, peanuts, hummus, things like this are packed full of calories in a very small area. So understanding that concept is crucial for your success. Number 4, not eating your protein first, not focusing on your protein intake. If I were to ask somebody who had weight loss surgery for a few months how many grams of protein they're eating, I don't expect them to tell me the exact number, but I do expect them to at least have an idea for how many grams of protein that they need and that they are eating. And if you don't, that's a big mistake. Now, the only way you're going to meet your protein's needs with a smaller stomach is to eat the protein first almost every time you eat. Almost every time. Of course, there'll be times when you don't, but make that your mantra. And number 5 is exercise or not exercising. You know, some doctors and surgeons actually tell their patients not to exercise for the first year after surgery or the first 6 months after surgery. Now, we don't know exactly what's right or wrong here, but what I do know is that if you are exercising regularly, there's more. It's about more than just weight loss. It's about your mood. It's about how you feel and how motivated you are and how you feel about yourself. So there's so many great benefits to exercise that aren't actually related to weight loss. So those are my 5 tips for you. I actually have many more mistakes that my patients I've seen are making the first year after weight loss surgery, or even the second year or third year. So follow me and I'll make more videos on this.